I'm Dr. Anita John, the chairman of the board for the IAMA Charitable Foundation Clinic. I would like to briefly walk you through the services and the activities of our clinic. The Indian American Medical Association Charitable Foundation was established in 1994 to further the philanthropic activities of its parent organization. The Indian American Medical Association is an association of physicians of Indian origin in Illinois and has been in existence for more than 34 years. Besides being a voice for physicians, IAMA has worked towards promoting health in the community by conducting health fairs and health education seminars for the general public. In the 80s and 90s, more than 48 million people in the United States, nearly 1 in 6, did not have health insurance, and more Americans were slipping through the cracks of the healthcare system. Realizing the severity of this problem, the IAMA has tried to provide a safety net for the medically underserved. In December 1994, the Indian American Association Charitable Foundation started a free clinic. At first, it shared space with the Indo-American Center in Chicago. Since its inception, the clinic has served an increasing number of underinsured patients from all over Chicagoland. In April 2002, the IAMA-CF acquired a building on Peterson Avenue in Chicago to house the health clinic and provide a permanent office space for the IAMA, Illinois. The clinic was inaugurated at its new facility in June 2002. The IAMA Healthcare Clinic is located in an area that is point of entry for many immigrant communities. As such, it serves patients from various ethnic backgrounds, religions, and nationalities who are linguistically and economically challenged, who do not have a safety net or health insurance.
Coming from Bombay.
You have a fever today?
Yeah, થોડું આમ સારું નથી લાગતું.
What did he say?
He's not feeling better, a little bit.
How did you find out about this clinic?
Some friend told me they are coming here and they say it's so nice, so helpful, and all the doctors and everybody, they check you deeply, whatever your questions, they give you all answers, and they feel you so comfortable and everything. And I feel, I came here and I feel it is everybody so friendly, so nicely, they
Very
listen
nice to
me.
hear. Thank you very much.
The clinic is committed to providing basic primary health care, preventative medical care, public health education, and community health care research with dignity and respect. The clinic has grown from seeing about 900 patients in 2006 to about 3,000 patient visits per year in the last few years. It is open on Wednesdays from 3 to 7 p.m., Saturdays and Sundays from 10 a.m. to 2 p.m. In the last few years, we've added specialty clinics like dermatology, flu shots, diabetes education, and most recently, the addition of optometry. We are proud to state that to date, we do not have a single patient with diabetic retinopathy. The clinic also implemented electronic health records about a year and a half ago. All of this is possible because of your commitment to our principles of philanthropy, volunteerism, partnership, and teaching. Philanthropy. The annual fundraising banquet generates about 80 to 90% of the funds required for the day-to-day operations of the clinic and providing free generic medications and limited lab work. Please be assured that 100% of the net proceeds from this event is utilized to run the free clinic. Volunteerism. Without the help of volunteer physicians, students, the clinic would not be functional. The clinic needs more volunteers. At no time should a patient be denied health care due to lack of physician volunteers. Our volunteers are very dedicated to this clinic and show up in spite of inclement weather conditions, after being on call all night, or even because of their personal health challenges. Please spread the word around and recruit more volunteers. Partnership. The IAMA-CF has partnered with several organizations. The Free Health Clinic has received support from various organizations such as the Indo-American Center, the Chicago Medical Society, Illinois State Medical Society, Ravenswood Foundation, Swedish Covenant Hospital, Stroger Hospital of Cook County, New Life Volunteer Services, Illinois Association of Free and Charitable Clinics, Chai Trek, College of Optometry, and the Indian Pharmacists Association. We need to continue these partnerships and add more to continue to serve the underserved. Teaching. The clinic serves as a great learning environment for students from 6 area medical schools. This is coordinated by the New Life Volunteer Services. Students gain hands-on experience treating indigent patients from diverse backgrounds. It's a great learning experience. Here the students truly learn both the science of medicine and the art of medicine. We're committed to continue this mutually beneficial experience. In 2010, Channel 7 News did a special segment about our clinic.
The Indian American Medical Association's Charitable Foundation is meeting the demand for healthcare services in the South Asian community. Their free clinic is thriving in part due to the volunteer efforts of Chicago's medical community.
Although we are going to have universal health care coverage, I think that this clinic is still going to need to be here because there will still be a significant minority that is still going to fall outside of that safety net.
There are certain cultural barriers, especially that women in certain communities, Asian American communities, face in accessing mainstream services. So clinics like ours are, I think, still needed.
Dr. Anumeha Gupta is the chief resident at Mercy Hospital and Medical Center. Here at the clinic, she's a volunteer supervising medical students and providing a cultural connection.
When you are approaching somebody with diabetes and hypertension and high cholesterol, common medical problems, oftentimes you're going to have to consult them about diet and lifestyle changes. I think the diet and lifestyle is directly related to the culture that that person comes from.
Volunteering has been a hallmark of Dr. Gupta's career, allowing her to develop her knowledge of patient care as a med student and a physician.
It helped me become a better student. It helped me become a better doctor. So this is my way of giving back to the community that I've come to call home.
The Sridhar Nimagata Memorial Building, located at 2645 West Peterson, is open 3 days a week, providing health care and a limited pharmacy for anyone in need.
As an immigrant community, I think we have done really well for ourselves. But I think that there's certainly a large subset of our community that is in need for free health care.
The census is a huge determinant of that as well. The census gives information back as to where large tracts of immigrants are, and especially more socioeconomically challenged immigrants are.
We're talking about a very large, very heterogeneous, very diverse community. We're talking about people from India, from Pakistan, from Bangladesh, from Sri Lanka, basically the entire Indian subcontinent.
As you can see, the volunteers are working hand in hand with the foundation and are providing invaluable healthcare services. Together, they're making things happen.
Oftentimes, this is the only place available for them to come get care. I think the patients also like the fact that the physicians here are able to converse with them in their own native tongue. So I think there will always be a need for a clinic like this, and I'm really glad that this organization exists in the capacity that it does.
In conclusion, to quote Mother Teresa, not all of us can do great things, but we can all do small things with great love. Thank you.